Hi, my name is Ryan. I am one of the main physios at Integral Performance Physio, and today we want to talk about foam rolling. So foam rolling is one of the very useful tools that we believe in to help control tensions, aches, and pains, and it's something that we recommend very frequently to our patients. And that's because you can buy a foam roller, they're not expensive, and you can have it at home, and whenever you feel any tension developing, you can roll on the foam, and it oftentimes helps prevent it from developing into a bigger problem. Now, before we get into foam rolling, we just want to make sure that you can check with your physical therapist that foam rolling is actually safe for you, since when you're lying on the foam, it does apply a decent amount of pressure on your spine. So you just have to make sure that you don't have any conditions that would contraindicate that type of pressure on your spine. So first things first, the two areas that we want to focus on are the lower back and the upper back, so in between the shoulder blade area. And those areas are actually the most common to develop tension when you have office work. So let's start with the upper back. So you put the foam roller horizontally like this, and then you will lie down on the foam roller like this. The foam roller is placed in between at your shoulder blade level, and you should be able to find some points that you find actually quite sore. You can put your hands behind your neck in order to support so it doesn't strain your neck. Your bum is lifted up, and then all you're going to do is just push up and down like this so that you're rolling your back, and you're rolling a small interval at a time. You don't want to be rolling all the way up and all the way down. And the reason for that is because if you roll all the way up and all the way down, you actually have to contract your muscles quite a lot in order to guide through the movement. And when you contract your muscles, the pressure actually goes less deep into the muscles. So it's less effective, the foam rolling. So you want to just focus on one little zone at a time. And you'll take about 30 seconds to 1 minute per zone until you feel like the muscle pain and soreness seems to be subsiding, okay? Then you'll just shift to a different level, and again, you can roll up and down. Once that is comfortable, you can also practice bending backwards and bending up a little bit. It's almost like doing little sit-ups, but you're really using your arms to pull your head and your spine forward and backwards. So this helps to mobilize it by bending the spine forward into flexion and backwards into extension. For most people, it's really the extension that's going to be important, since we spend most of our days sitting hunched forward like this on the computer. So something to push us to straighten up and open the shoulder area is going to be very helpful. So you can do foam rolling like this, focus on 3 to 4 zones. So for the upper back, it might take about 3 to 5 minutes. That's usually what's recommended. Then for the lower back, how we're going to do it is you lie again on your back like this. Then you bridge up, so you lift your bum up, you reach through to put the foam roller in the lower back. Now the foam roller should be placed slightly above where the belt line is. So if you see here, it's right above where my belt is. So the foam roller will not be putting direct pressure on top of the belt area. Now your feet are still taking a little bit of the weight, but your back is taking probably about 50 to 60% of the weight. So then again, you can just roll up and down like this. The key thing, same as with the first exercise, is that you keep your back nice and relaxed. And once you're relaxed, then you'll really feel the foam roller putting pressure into the muscles, which is what actually helps to loosen them up. So you roll up and down here, then you can scoot down a little bit, roll up and down here, again focusing about 30 to 60 seconds per zone. You can also practice tilting the knees to the left, tilting the knees to the right. That's usually when you want to focus on the muscles a little bit more to the side of the back, or if you just want to focus on more on one side of the spine. So you can just rotate like this. You can also open and close like this. This also helps to get a little bit from the center outwards to the side of the muscles. Now, another important point is that after rolling in this position, your back will not want to contract the muscles hard. So in order to get out of the position, I don't want you to swing up into a sit-up to get out of it. Instead, you get into the bridge position, very gently lift the bum up. You're going to notice it's a little bit sore after rolling. And then you just push the foam roller out. You allow your back to come back down. And then you can roll to the side in order to get back up. So those are two of the most common foam rolling methods that you can do. Foam rolling could be used for and everywhere else. You can use it on the quads, on the glutes, on the shoulder blade, and it's all effective. And we can definitely dive into that in another video. So I hope you find this helpful. Try it out. If you have any questions, don't hesitate to reach out. And if you have any pain that you find you don't quite understand, you don't know where it comes from, definitely contact your physical therapist. So take care and enjoy the foam roll.